Hi, I'm Dr. Larry Malerba. Welcome back to the All Things Homeopathy channel. Today I'll be talking about some of the main remedies used for the treatment of women's urinary tract infections. In the previous therapeutics episode 4A, I discussed important clues to be aware of when evaluating the symptoms of a urinary tract infection. If you haven't already seen it, I highly recommend that you watch that episode first before viewing this one. Okay, with that said, let's jump right into our discussion of remedies for UTIs. All right, let's begin with Aconite, which is a remedy for early stage, sudden onset of acute UTI symptoms. We think of Aconite in cases of cystitis that occur immediately at the onset of a fever or upon catching cold. There can be high fever and chills, especially after exposure to cold, dry weather or after a serious fright. The urine can be red, hot, and scanty, and urination is painful. There's acute burning pain in the urethra or at the urethral meatus during urination. Of course, aconite symptoms are often accompanied by anxiety and restlessness. There may be an acute fear of impending death. Sometimes there's difficulty in passing urine. It's a remedy for suppressed urine from fright or shock. Aconite is indicated for urinary retention during pregnancy or after labor and delivery, especially when accompanied by anxiety or fear of death. It's also one of the main remedies for acute bladder infections that follow after catheterization or after cystoscopy. So this list of etiologic factors are clues that answer the question why, which in turn make us think of the remedy aconite. With apis, there tends to be great irritation of the bladder. There can be an intense burning or stinging pain in the neck of the bladder before and or during urination. There is strong and frequent or constant urging to urinate, but urine is passed only in drops with great difficulty. The person may scream in pain while straining to void urine. General clues that point to apis can be very helpful in choosing this remedy. Those clues include the keynote lack or absence of thirst and a strong tendency toward retention of fluids. There can be swelling anywhere in the genitourinary region or anywhere in the body for that matter. General clues also include an aggravation of symptoms from warmth or heat, an amelioration of symptoms from cold, and an aggravation of symptoms at night. There may be involuntary urination or, conversely, retention of urine. Apis is indicated for urinary retention after labor and delivery, and is one of the main remedies for nephrotic syndrome, which is characterized by systemic edema coupled with spillage of protein into the urine. While the literature claims that Cantharis is the number one remedy for acute cystitis, it depends on how we define acute cystitis. While some UTIs match the classical description of Cantharis, most UTIs that I've seen in my practice don't reach the level of intensity that would indicate this remedy. Perhaps this is because of the modern world's accessibility to antibiotics. Oftentimes I'm consulted for unresolved UTI symptoms after an antibiotic has already been taken. In any event, Cantharis is indicated for the rapid onset of severe urinary symptoms with intense pain and intense burning. This is a remedy for the most painful of UTIs. The pain has been described as violent, cutting, lancing, and searing. The urine is red hot and scalding and passes in drops, oftentimes with obvious blood. The pain occurs before and after, but especially during urinating, and can be anywhere along the urinary tract from the kidneys to the urethral meatus. It's common to see strangury, which simply means that small amounts of urine are passed with great pain and difficulty. And we often see tenesmus, which is an involuntary and painful spasmodic straining of the urinary tract muscles, which is oftentimes ineffective in causing urine to pass. One additional keynote clue that can sometimes indicate cantharis is a very strong sex drive. Next up is cannabis sativa, which is mainly a remedy for urethritis. It most specifically fits pain located at the urethral meatus that occurs at the close of urination. There can also be burning pain during urination. Although burning pain is often concentrated at the meatus, it can extend backwards up into the bladder. Spasmodic closure of sphincter muscles may interrupt the flow of urine, especially toward the end of the urine stream. Cannabis sativa is also a remedy for urethral discharges, including gonorrheal discharges in particular. The discharge is purulent and yellowish green in color. Sarsparilla is also a remedy for pain that occurs mainly at the close of urination. But unlike cannabis sativa, the pain is usually not localized to the meatus. There's burning pain in the bladder or urethra, along with discharge of bloody urine, all of which are aggravated mostly toward the end of urination. There may also be sandy red urine sediment. In addition, sarsaparilla is the strongest remedy listed in repertories for difficulty with urination that is ameliorated by standing. And it also lists for complete inability to urinate while sitting that can only be relieved by standing. Another keynote clue for sarsaparilla is that it fits urinary tract conditions that occur in combination with skin symptoms. It's a remedy for eczema, herpes, and skin conditions that involve cracks or fissures, especially on the hands or on the soles of the feet. Whenever we see skin conditions associated with or concomitant with urinary tract issues, we must think of sarsaparilla. Staphysagria is the main remedy indicated for honeymoon cystitis. In other words, it fits UTIs and bladder infections that are triggered by the physical trauma that can sometimes accompany sexual intercourse. This can occur either after a woman's first sexual encounter or after a great deal of sexual activity. Once the pattern is set up, infection can be easily renewed by subsequent sexual activity. You may recall from the Materia Medica episode number 14 that staphysagria is a remedy for ailments from sexual abuse. Emotional states associated with abuse, such as anger, mortification, and indignation, can also be aggravating factors for staphysagria, thus potentially triggering urinary tract symptoms and conditions. There may be frequency and painful urging, and there can be urethral and or bladder pain that occur during and after urination. Of particular note is that staphysagria is one of the main remedies for pain that is worse when not urinating. You may also recall that staphysagria is a remedy for any kind of physical insult to the urinary tract. Thus, in addition to sexual intercourse, symptoms can be brought on after catheterization, after cystoscopy, or after other surgical procedures. As with aconite, we see a number of etiologic factors that can bring on Staphysagria symptoms. Okay, benzoic acid is a remedy to consider when urinary conditions involve urine that has a very strong odor. There may be either difficulty urinating or involuntary urination, but the keynote clue is a strong ammonia-like odor to the urine. The books describe it by comparing it to the odor of a horse's urine. Natrum carbonicum is similar to cannabis sativa and sarsaparilla in that it is also indicated for urethral pain at the close of urination. There's irritation of the urethra, and this may be associated with cracks or a fissure at the meatus. Nat carb also happens to be one of the main remedies indicated in cases of female infertility. I once had a patient who developed a UTI. I prescribed nat carb based upon the symptom of pain at the close of urination. It worked almost immediately. But the amazing thing is that she called me a few weeks later to tell me that she was pregnant. In our prior discussion, she had forgotten to tell me that she'd been trying unsuccessfully for years to become pregnant. The UTI turned out to be a serendipitous opportunity for nat carb to help solve a more chronic health problem. We think of causticum whenever a urinary condition involves some kind of paralytic symptomatology of the bladder. Commonly, there is incontinence or involuntary leaking of urine, which is aggravated by coughing, sneezing, or laughing. The urine stream may be slow or weak, and the person may have to wait long for the urine stream to begin. One peculiar causticum symptom is ineffectual urging of the bladder that is worse while standing, while at the same time urine may flow involuntarily while sitting. Strangely, causticum also lists under retarded urine ameliorated by standing. It's also a remedy for paralysis of the bladder after labor and delivery, and it fits bladder paralysis after holding onto the urine for too long or resisting the urge to urinate for too long. Of course, causticum is also known as a remedy for enuresis, or loss of bladder control during sleep, especially during the first few hours of sleep. Opium is another remedy that fits paralytic conditions of the bladder. There may be a lack of awareness that the bladder is full, accompanied by an absence of urging to urinate. It's the main remedy for bladder paralysis after surgery. Recall that opium often has a similar paralytic lack of urging to stool in cases of constipation. Next up is Mercurious, which can have burning pain before, at the beginning, during, or after urination. The burning can be particularly intense as the last drops of urine pass, and there may be burning even when not urinating. There can also be urgency, frequency, and tenesmus. Mercurius is a remedy for thick yellow or green purulent urethral discharges, which is why it is also a remedy for gonorrhea. Oftentimes, we choose this remedy because of the generals. There may be fever, sweats, and chills, or temperature instability. The patient may complain of feeling hot, then cold, and then hot again, and the symptoms are often worse at night. Many years ago, I had a patient who took an antibiotic for urinary tract symptoms that had lingered for months. The UTI cleared up immediately, but she promptly wound up in the hospital with a violent attack of what the doctors were calling rheumatoid arthritis. When she explained to me from her hospital bed that she had had a strange metallic taste in her mouth for months during the UTI, and that she still had it with the arthritis, I knew what to do. Based upon the keynote symptom of metallic taste, I prescribed Mercurious. Within days, her arthritis was completely gone and her UTI symptoms never came back. Mercurius corrosivus has generals and a symptom picture similar to Mercurius, but the emphasis here is on the intensity of the burning and the tenesmus. Both the urine and the urethral discharge burn so strongly that they can excoriate the surrounding tissues and skin. Likewise, the intensity of the tenesmus is on a par with the tenesmus of remedies like Cantharis and Nux vomica. Okay, terebinth is a remedy for some of the more severe UTI cases and kidney infections. There can be burning pains, blood in the urine, and urethral discharge. The urine can sometimes look like pure blood. Keynote clues for this remedy include dark, smoky-colored urine with a sediment that looks like coffee grounds, and a very specific and peculiar odor to the urine that smells like violets. Phosphorus is a remedy that we always consider whenever hemorrhage is involved. When there's a lot of blood or bright red blood, we think of phosphorus. Confirmatory generals include a strong thirst for cold drinks and a desire for company and emotional reassurance. Likewise, we consider belladonna for a UTI when we see general symptoms of the remedy, such as sudden onset of high fever, redness, aggravation at 3 p.m., and aggravation from touch, motion, or jarring. And lastly, Pulsatilla, which is not a particularly intense remedy. Therefore, it tends to be a remedy for milder UTI symptoms. But even though the symptoms may be mild, the pain threshold of the patient is often rather low. Symptoms of urinary incontinence are common and can be aggravated by laughing, coughing, or sneezing. And of course, we often rely on some of the well-known Pulsatilla generals to confirm our prescription, such as a lack of thirst, aggravation from heat, desire for open air, and a desire for company with emotional sensitivity and a tendency to weep easily. Okay, that's a pretty exhaustive list of UTI remedies. I hope I was able to clarify their differences and minimize some of the confusion that goes with learning them. As always, I welcome your questions and comments. Please don't forget to subscribe. And many thanks for watching the All Things Homeopathy channel. May the vital force be with you.